Let's welcome in our co-hosts. He is the Admiral, Bill Stubblefield. Good morning, two-star.
This is a beautiful day. The dogs enjoyed the run.
Some folks are already wishing for spring, Bill.
I know. I saw that on a couple of Facebook comments. Let's enjoy the winter. We don't have this all the year round, so let's get out and enjoy.
There's a saying in football camp in August when you're out there sweating and it's hot and humid. Yeah. Enjoy the suck. That's what you got to do in the winter when it's 4-degree wind chill factor. Just embrace it, baby.
But I have to admit, the last couple of days, I've done a lot of plowing, a lot of snow blowing, and a lot of salting. And at times during that, I kept saying, man, it'd be nice a little bit warmer. But basically, all in all, this beautiful time of the year, lovely time of the year. Get out and enjoy it. Let's also say good morning to Maria Lawrence and All-Star.
Good morning. Good to be here. Just a comment on winter. I sent my family members a little meme yesterday that I found 2 stages of winter, and it had December, a magical wonderland of lights, had a snowman and a Christmas tree, and then it says January through spring, a cold gray bucket of suck.
See, you got to embrace the suck.
And you have a heated vest and heated coat.
It's not on.
But it's not on.
She doesn't have her batteries.
We don't need it here. I have my batteries, but not in here. Later on, when I go for my walk, I will definitely. It has come in handy.
Let's say good morning to our first guest. He is the Chief Health Officer for the Berkeley County, Morgan County Health Department's Dr. Kevin McLaughlin. Good morning, Doc. How are you?
Good morning. Happy New Year. Haven't been back in a while. Happy New Year. Happy holidays to all.
It has been a little while. How have you been?
Doing well. I can't really complain. Life is good.
Good. Great to have you here.
Hey, before we get to the other topics, I wanted to make one comment on I know the health departments sponsor the radon test kits.
Yes.
I will throw out a personal thing out there, a little anecdote. When we built our house in Morgan County 25 plus years ago, I picked up a radon kit from the Morgan County Health Department at the time, not knowing anything, got it tested, sent it off, and it came back off the charts.
Whoa.
To the point where we actually had a passive system built into the house because we had the house built. And we actually had to bring in a remediation company to put in an active system to actually take the radon out. Because there's actually a huge, I guess they call it a seam of radon that comes over from Jefferson, Berkeley into Morgan. And when you disturb that dirt to build these houses, that radon gas can actually come up. And this is the time of the year that it's really an issue, is because everything in our house is closed up.
Sure.
Okay, so during the summer when doors are open, windows are open, the gas has time to kind of get out and not really concentrate. But right now, everything's closed. I mean, it's, wind chill factors down into the low teens, mid-20s. People aren't going outside. Doors are closed. So any opportunity when that radon comes up, it just sits in the house.
How does one remediate a radon situation like that, Doctor?
So basically, they take it. For our situation, was a passive system. So basically, we had piping under our flooring of our basement with gravel, etc. Contractors would probably be able to explain it a lot better. This is just my observation. And we actually had piping going outside to take that gas that came up and kind of go out. So instead of a passive system, they actually drilled more holes, put in more pipes, and actually put in a vacuum system, a pump, fan, to essentially suck it out of under the concrete and pipe it outside. So we're down to normal, nominal, or very little levels, and that's the whole thing is that it is here, and we live right on it. It is the number 2 behind tobacco for lung cancer, and it's another one, odorless, tasteless gas and vapors, and you just bring it in. And there's ways to fix it, but you can't fix it until you know you have a problem. and the way to know that you have a problem is to get it tested. I mean, with all the new houses that are out there, go get a test kit.
It's free.
Yeah, free, and there's plenty out there. Just don't be surprised if it comes back elevated, and you got to do something about it.
And the West Virginia legislature reinstituted that grant so that the Berkeley and Morgan County Health Department can give out those free radon test kits. So I know the legislature gets blamed for a lot of things, but in this particular one, you have to give them positive accolades.
Oh, absolutely. I mean, this is something that we can actually help our public, our constituents, or the people that are in need of this. And it all goes back to you can't fix something you don't know is a problem.
Doctor,
Gotta go to the doctor.
radon is frequently associated with limestone rock. That's why we have so much of it in Jefferson, Berkeley County, and spots of it in your county, Morgan County. But is it cyclical? If you test negative or test for very low radon at one time, is there any concern that in time it's going to build up?
To the best of my knowledge, let's put it this way, I'm not sure. But I will tell you, if someone else is digging or building houses around you, the ground level is going to be potentially, or the soil, everything's going to be potentially disturbed, especially with all the roads being built, all the explosives that are being used to take things down. Things are constantly moving, so you can't sit on your laurels all the time. But
Test every couple of years.
Yeah, I mean, it's not going to hurt you. It's free.
I want to move on from radon
Sure.
and ask you about a bird flu death transmitted to a human who worked in, I think, the poultry field or cattle field. It was an elderly person, as I understand it, wasn't a young person.
And had health issues as well.
Had health issues as well. But let's talk about bird flu, how much of a danger this is. What is bird flu, and how much of a danger is it to humans?
It's an influenza-type virus. It's H5N1. To the best of my knowledge, there's only about 62, maybe up to about 70 cases in humans.
Worldwide? Or
No,
United
in the
States?
United
In the
States.
US,
It's
okay.
much more prevalent in other places, but there's only been one, I guess the first death down in Louisiana occurred earlier this week, last week. From what I understand, they had a private flock or a wild flock of birds that they were taking care of, that they were also had plenty of comorbid, that's the medical term for lots of medical problems, comorbid diseases. We got to throw in some medical talk in there a little bit. But had some other things in there. So, I mean, when they got sick, they just didn't have another medical talk. We talk about a physiologic reserve, meaning the body's ability to kind of get reserves to kind of help its heart, help its lungs, and everything else, its immune system. They probably didn't have the best immune system going forward, and it took over and got them. So, yes, there are a lot of transmissions. There's a lot of bird flu in our wild birds. They have been transmitted into other mammals.
How does it transmit to humans?
It's
just through touch?
No, it's actually respiratory, from what I understand. But it's if you're around a lot of birds, and I mean, there's a lot of transmission into cows, into other mammals, but it really hasn't crossed over into humans. I mean, with only 70 cases, it really hasn't crossed over into humans in the United States very much at all.
Do birds die from bird flu?
Yes.
Does it kill most of them?
I don't know if it kills most of them, but there is a very large number of wild birds that have it.
And in terms of transmissibility, if that's the right word, can a human transmit to another human then? How contagious is it?
I don't know of any human to human.
Okay.
But I do know that either from cows and from bird caring for birds, large bird flocks, there is rare transmission from there, but.
Gotcha.
But now you mentioned cows and birds in the same sentence. Is it an association? Does it convey from birds to cows, or is there a separate issue of disease that virus goes the other way?
From what I understand, the proximity and the cows grazing and everything else, and all the birds out there, and with the high population of the birds, actually the wild birds actually having it, it has crossed over there.
Does that mean more of a greater danger to humans, the fact that cows have it?
Not that I know of. Now, I may be incorrect on that. That's not something that I've heard a lot of. I do know there are surveillance programs for testing and getting cows, large groups of cows that are being tested and kind of followed. That's one of the ways that the states are kind of seeing the spread and seeing prevalence in the area. I don't know of any in the area. I probably would need to get either Robert Diener, our epidemiologist, or Jen Schertrumpf, our information person. They're a lot more on the specifics on the true transmission of that stuff.
Is it associated with weather at all? I know in the early days of COVID, we thought that it was influenced by temperature, but
not that I know of.
Mm-hmm.
Let's talk norovirus.
Norovirus.
I understand this is knocking people for a spell now.
So norovirus has been around for a long time. So if you ever hear of the cruise ships that tend to get outbreaks of gastrointestinal diseases, it is a highly contagious virus. There are millions of viruses. This one, it tends to come into the system and cause vomiting, profuse diarrhea, dehydration due to both inability to eat or drink. And it's going to make those that are susceptible, well, everyone's susceptible. It's going to make those that have those comorbid diseases that much sicker. I mean, working in the ER the other day, we probably had 5 or 6 families that it was just wiping out. One person literally was on the commode, vomiting and having diarrhea at the same time, while just sitting there, and essentially passed out because of everything going on. And then, I mean, it's pretty nasty, transmitted by fecal oral, another medical term for basically from bathroom, from using the commode.
So wash your hands. Yes?
Yes, absolutely.
Disinfect your bathroom.
Correct. And so when it's on a cruise ship, they literally take everybody off, or basically, and just do a whole disinfecting of everything. But, I mean, you look around, a kid is going to use the bathroom. Do they always wash their hands? Does anyone always wash their hands? I mean, as a person of observation, I like, you walk out of a restroom, a public restroom, we all see it. People use the facilities and don't wash afterwards. I mean, it's kind of gross, but it is gross. But we see it all the time. They touch things. You touch things. They touch tables, handrails, doorknobs. So, I mean, it's not only just wash your hands, it's be smart. Try not to touch your face. If you know people that are having this illness, stay away. be smart.
And when you leave the restroom in a restaurant, don't use your hand to open the door. Get a paper towel and then use the handle to
Amen.
open the door.
Yeah, and some of them now have those little latches on the bottom of the door to use your foot to kind of catch it and pull it out. You know, use your elbow, use something else. I mean,
I just assume most people don't wash their hands when they leave the bathroom.
it's kind of a sad commentary
Rob's
on
face.
our society,
It
but
is.
you're probably
Not far off.
far off. And literally there are millions to billions shed when a person is having an episode, and it only takes 100 or less to start the flow in your body.
I had C. diff in 2016. I'm not going back there.
Yeah.
I take precautions.
Yeah.
What precautions can you take with neurovirus? Is there vaccination you can take, or is just
No, not that I know of. But it's, hand hygiene. It's hygiene of everything, clean everything. So if someone's getting it, just start washing.
But there's a limit of what you can do with that. You can be very careful
Correct.
and wash your hands, but still, by definition, we're all going to be touching this desk, and we just
Correct.
make the assumption that the other guy has taken some precautions. But there's nothing except for being just overly conscious. Is there anything you can do?
Not that I know of. I don't know of any specific vaccine, but just got to be smart. And when it hits one person in the family, just know that the chances are it's going to go through that family quickly.
So disinfect the house.
Yeah, pretty much.
And how long it can last? I mean, we're not talking 2 or 3 days. It can be a longer period of
it
time.
can be up
yes?
to about a week, but most people once they start, it hits. I mean, it just within 24 hours of starting. I mean, you have bodily fluids coming out multiple.
We got you.
Yeah.
So,
Impression has been made.
yeah,
We're all
I painted that picture
We're
pretty good.
Good
huh?
paint.
All right,
good paint.
good.
Picasso-esque. Let's talk flu season. How effective has the shot been so far this year on flu season? Any feedback yet?
No, I haven't seen the feedback. We are seeing a lot of influenza A. That it really seems to be a pretty heavy, a pretty hard-hitting influenza this year as well. We're seeing a lot of people getting really sick and actually needing more admissions to the hospital from it. So over the last 5 years, since 2020, it's been most of the major respiratory stuff has been COVID. I mean, influenza A and influenza B are always there, but COVID seems to still be there. We're still seeing some of it, but the sick ones, respiratory-wise, are the influenza A right now. It is a very hard-hitting respiratory virus. Just to go back to the Spanish flu of the 1917?
16, 17.
Yeah, was an influenza A type influenza at the time, and it wiped out millions, hundreds of millions.
Is there a correlation between the intensity of the flu and the number of people getting a vaccination? Are we seeing a decline in vaccination?
Well, there's a hesitancy amongst the general public for any vaccination right now. Whether it's justified or not justified, we could debate for hours, days, years. Vaccines work. Public health statement, vaccines work. Are they perfect? No. No one will ever say that they're perfect. But, I mean, I think that's a good decision or a discussion to have a person that has those comorbid diseases. You have COPD, you have emphysema, you have asthma. Do you really want to get an influenza virus? Maybe those people should definitely get it. I mean, that's the recommendation. But, we're seeing hesitancy for all vaccines. I mean, that'll even be discussed down in legislature this year of, you know,
I'm sure it's going to get repealed.
well, to a certain extent. But the thing is that nobody wants an outbreak in our area of mumps, measles, etc. That we know are preventable with the MMR and the vaccines. Again, are they perfect? No. Are they, you know, out of the hundreds of millions of people, the numbers are quite low. Someone was talking about pertussis that somebody got, whooping cough.
I just mentioned that beginning of the show, yeah.
Yeah, so the CDC actually recommended several years ago that whenever you get your tetanus shot, if it's been a while, that you should actually get one with pertussis, a Tdap, to make sure that we rebooster for pertussis, because they have noticed that the immunity to pertussis wanes over time, and it's actually come back. And we actually had family personal experience, a basketball team when my kids were younger. One of the girls got pertussis, and it went through everybody, and everyone had to be reboostered for it. So, I mean, it's another respiratory virus. And we look at most people young and healthy or middle-aged healthy, and we outwardly look healthy, but we don't know what's going on inside. And the vaccines a lot of times prevent and protect those that are very vulnerable. Our youngest, our kids, and our older age ones that basically their immune systems either haven't developed yet or aren't as robust as they were in the past. So those are the people that we want to make sure that we're not missing, and that we get the flu vaccine. You get your pneumonia vaccines. You get
RSV. Got them all.
That's a big one right now.
Which the kids are getting quite sick.
Yeah, they are.
And they're the ones that are vulnerable. And then with all our kids, or many of our kids, that are being raised by grandparents in this, I mean, that's another thing for our society kind of to deal with, is that we have a lot of our children being raised by not their parents, but by their grandparents. You get something at school, you got a young kid, and they bring it to somebody here. We're one of the largest smoking states with lots of other medical problems, etc. You know, why don't we try and help them as much as possible? So,
Doc, thanks for coming in today.
Not a problem, anytime. You know, to give me a call whenever you need something, and I'll be happy to come in and talk as much as you need me to talk.
Appreciate your assistance today, sir.
Thank you.